So here we are today with doctors in public service on strike. It's day 2 into that strike action. Prior to this year's May Day celebrations, I had a chat with the Deputy General Secretary of the Ghana Medical Association, Dr. Justice Yankson, who gave me an understanding of the issues concerning their conditions of service. We'll bring you a playback of that conversation. Issues can get a bit complicated. So first of all, I want you to outline what the issues are with doctors today.
Well, the major outstanding issues are, let's say, from the top, our conditions of service document that is yet to be negotiated and signed, to our conversion difference and pension reductions. The two are linked. The reduction in our pension contributions and benefits thereof is as a result of the migration onto the single spine pay policy. The next is the periodic non-payment of salaries of doctors, especially the junior doctors, who play a very critical role in the healthcare delivery system. And all the other labor issues, as you may know, tier 2 and what have you, the GMA is also part of it because our members are also affected. So basically issues of labor, especially pensions.
Let's go to your conditions of service. It's amazing that you would accept to work when you don't know the conditions that you're working with.
And that's the irony of it. And it also tells you, excuse me to say, the kind of heart people who are described as professional doctors in this country have when it comes to the affairs of the ordinary man. Truth is, if we all decided that we were going to really stick to some of these things, there's no way anybody would have received healthcare in the public sector, because, I mean, clearly it's absurd that professionals wouldn't have. But sometimes we are forced to look at the plight of the patient and just go to work. But the truth is that we've gotten to a point in our lives where we are saying that enough is enough. If you look at it, let's even bring it back home. In recent times, the minimum you can look at this is 19 years, because the Ghana Health Service was established in 19 years ago. And from that point till today, doctors in the public service have had no conditions of service at all.
So what do you work with?
Yeah, nothing. Basically, it's just your salary, your base pay, and then beyond that, you just go out there to serve the people. Basically, that is it. The only other thing that supposedly we have, which is not even written, but it's become like a convention, is that if unfortunately I should pass on in the course of work, then I'm entitled to about 1 or 2 weeks maximum free mortuary services.
That's nothing.
All. Yeah, but that is the only thing. As we speak now, assuming we're in the clinic and I even fall sick, I have to go out there and buy the drugs myself. Even if I have to even use my NHIS card, assuming it is working, I pre-finance it because I pay the premium. My employer hasn't paid any premiums for me. Unfortunately, that is the truth. If I contract an infection from a patient, I'll have to deal with it myself. If I'm admitted onto the ward, I'll be presented with a bill at the end of my stay on the ward to go and pay. Meanwhile, they expect me to be at work the next morning or that same day.
That sounds, that sounds unbelievable, really.
Well, but that is the truth.
But what happens to those who retire?
They apply to saving, nothing to write home about, because it's for me one of the most inhumane treatments that any group of people can be subjected to, because there are people who are more or less of the same professional standards in this country, let's say related in other professional jurisdictions, and they retire on their salaries and perks and what have you. A consultant doctor who would have served the country for 30, 35 years and beyond will go home with nothing except the monthly benefits from this.
So this was the situation far back in May, And I'm sad to say that it remains the same. The reason they've called this action, what we've heard today is that they're back on the negotiating table with government, but the strike still continues. Let's talk to one gentleman who knows all about these issues. Let's see how we can better resolve this. Gabriel Benako is the national chairman of the Coalition of NGOs in Health, and he joins me here for a discussion on this particular subject. So good morning to you. Thank you for coming.
Good morning, and thank you too.
What's your understanding of this whole strike action and the conditions of service? Where have they got into? What did they disagree about?
Okay, thank you. Good morning, Ghana. Good morning, everybody, and good morning, especially the doctors and the Minister for Labor Relations. Ghana seems to have very good laws. When it comes to laws and policies, we quickly get them on board, and that is a good thing about Ghana. We are professors in laws and policies. What is happening now for both the Ghana Medical Association and the government is being normal, as we put it in Ghana. This is normal without taking to the effect and the implications on the ordinary Ghanaian. What is happening, we the Coalition of NGO is not happy, representing 200 districts, and when I was called to make this my statement on TV, I had 7 regions. I have already consulted 7 regions out of the 10. And it is true that some doctors are not at post, they are not working, but honestly some doctors are working.
Yeah, the news that's coming in this morning is that more regions are set to join because they have not gotten hold of the memo that had been sent out.
Yeah, so some doctors are responding, others are still communicating to take action from their organization. If you look at the Labor Act, especially if you look at the Part 12 of Section 97 or so, it talks about negotiation. And it's quite appealing. The approach the minister is using now is quite appealing. This is better than previously.
So what is this approach?
Yeah, he is listening.
Okay.
Except that they have not agreed. And that is the best approach. And if the minister is listening, or anybody from the special assistant to the minister, kudos to him. But the doctors have very strong reasons to go on the strike. This is an honest statement, and we, the coalitions, yes, we recognize all the challenges that doctors go through, but what we are pleading now is that whereas they have very strong case, their issues on their rights has been violated, the agreements to the certain times have not been adhered to, but we are pleading them to, once negotiations start, strike cannot also go on.
But do you appreciate the fact that they've been negotiating for such a long time now?
Yes, but
so if somebody is listening and not taking action, it's just like not doing anything at all.
Exactly. That's why I'm calling on the leadership. The approach now is better than before, but what we are asking is the minister should get his team, and of course, from all the negotiations, I haven't seen an expert helping them to negotiate. That is one of the sad part of it. If they have an expert, yesterday and today, I expect that they should come out with a very
what
clear...
kind of experts?
You need a labor expert.
Okay.
This is not... I know the minister is a legal person, but this is a specialist area. And when you are in conflict, you cannot mediate yourself. You cannot dress your own wound. Somebody have to dress it for you so that the person will know how the bruises are and the areas that need to be cleaned well.
Okay, so let me bring in this particular insert. Labor expert Austin Game, he's faulted both governments and the GMA for the current strike by the doctors, explaining either of the parties could have turned to the National Labour Commission for a resolution of the issues.
Sure. They are definitely in breach. Both sides, the employer and the union, they both should not even have started the negotiation in the first place.
Right.
Because if the rules they claim they have is anything to go by, you cannot be threatening someone, holding a gun on him,
right,
or a knife on him,
exactly,
and you ask that you should come and commence negotiation. It's inappropriate.
Right.
It's not done in any civilized society. The union is guilty for, threatening the employer,
right,
and pressurizing the employer because of the sensitivity of the job they do,
exactly,
and compel them to come to the negotiation table, and then using adversarial approach in the negotiation.
Right.
The employer should immediately report this matter to the appropriate quarters.
Okay.
And the right place to go is the National Labour Commission.
Right.
And the Labour Commission will give an order for them to stop the strike immediately,
okay,
and compel both sides, if they think that they cannot resolve the matter through the civilized way of negotiating the condition of service, then compulsory arbitration will be triggered. They want to make effort to have a condition. There's nothing wrong, and I support them 100% plus to enable them have a written condition of service. There's nothing wrong with it.
Okay.
It's the approach that is completely out of gear.
Okay.
If they have submitted a proposal and the employer also agreed to it and they are sitting to negotiate, then there is a process they have to go through. And it's not compulsory that whatever they brought should be imposed.
Okay.
So both sides will have to discuss the issues. If they are unable to reach agreement on all or any of the issues, they have to package it, send it to the National Labour Commission, because they are essential service, as in the LI 1833, they are dedicated essential service. Within 3 days on reporting this matter to the National Labour Commission, they will constitute themselves either to a full panel, as it were, all of them, or each one representing the bodies that send them there,
right,
and they will go through that process and resolve the matter. In fact, the good news is that their matter can be resolved within 3 days, and so there is an end to their problem. So going to the press, making a demand that if you don't complete this for me, I will take a strike action is completely wrong.
All right, that's Labour expert Austin Game speaking to us on Thursday. Okay, so this is where we are. You're saying that it's wrong for them to be negotiating by themselves,
yeah,
without a Labour expert
exactly,
in their midst.
Exactly. So if you look at Austin Game, my father, I mean, not just talking because he's an expert, but he's also very passionate about getting people resolving issues. So if you look at what he was proposing, the minister needs to be advanced in the approach that he's using. First of all, the approach is very good for having the opportunity. Hitherto, they would have been resorting in insulting each other, casting insinuation here and there.
Oh, really?
Yes, they used to do that. But I think this approach is better. What we are appealing for the parties is that they should all be patient, and both parties should not issue statements as if they are right. During negotiation, or when there's an issue on strike, everybody have an interest. No matter what it is, everybody have an interest. People say there must be win-win before negotiation is effective. No, the interested parties' interests must be listened, and proactive measures must be taken to ensure that everybody gets something to go home.
Do you see that there's trust? Because even from where I sit, I feel that the doctors perhaps don't trust governments. So they either want to see the thing effected or nothing.
Yeah, I also feel that there has been frustrations in the attempt of listening to the doctors. That's my feeling, because we have collected data across the country, and having recognized that their service is a very essential one, and is very, very, everybody needs that. Even the minister talking, he needs help from these doctors. He needs help from. He needs help for everything. I'm sure even maybe within the week he has consulted his personal doctor. So everybody needs it. But once negotiations have started, we are appealing to the parties that please let's get a neutral person to facilitate the process. And negotiations should not be happening at the Ministry of Health, or it should not be happening at the Labor Office, the Minister's Office. I think negotiations should happen in a very neutral environment so that nobody take advantage of anything. That is why we are appealing now. So if
is it a complaint by the doctors? You know, have they said?
No, I'm just saying, because I don't know where they are having the meeting, but I'm giving the general principle during negotiation and mediation. You should have a very fair, neutral, safe environment for parties to be able to articulate their views and be sure. And they should not involve the media.
Well, I mean, the people need to know what's happening.
The media can be updated, but not the details.
They didn't give us details until somebody decided to put the details on Facebook.
That's a wrong approach. Anybody who have done that has done it very unprofessional, because even the minister, if you permit me, this is speak yesterday, the Minister of Employment and Labor Relations, Haruna Iddrisu, is optimistic that the doctors will not plunge the nation's health care system into chaos due to what is considered to be progress made. This is a very fair and professional way of presenting issues during negotiation. He should not go ahead to say that we didn't agree this, we didn't agree this, we have this entrenched position. That would not be helpful to the nation. Then I'm also very happy that the leadership of the GMA are following their rightful administrative procedure to get things done. What I'm pleading is that the minister should get a neutral person to facilitate the process. And I'm also pleading to the doctors, GMA, they are our friends. We just 3 days ago I had a meeting with them, and I think that they have very valid issues and concerns.
But you think they shouldn't be striking whilst they're still
when negotiations start
at the table?
When negotiations start, they should also consider the ordinary guy. As one of the doctors said, I mean, over the last 22 years, I mean, they have been battling with these issues for long, and they should see the people they serve as the most vulnerable. And we always say to teachers, their reward is in heaven. And so doctors, your reward too is in heaven. We cherish your...
Do you know how many people don't want to be teachers?
Yes, but...
When you go around asking kids, what do you want to be in the future? They're not, a lot of them wouldn't say, I want to be a teacher.
Yeah, but you and I, we are being taught by teachers. And sometimes you are not even aware that you become a teacher, and then you find yourself as a teacher.
And there are a lot of teachers who would say to you now, we want our reward here on earth and not in heaven.
Exactly. But the point is just clear that, I mean, they have a clear case.
Let's talk about the patients. Let's talk about us going to the hospital. What have you found out? What's happening in some of the hospitals, some of the public hospitals?
Yeah, I can be sure of Kolebu. Yesterday, our team were there. There were services being withdrawn at the OPD.
Indeed, there was a press release, there was a statement by the hospital itself announcing that the OPD had been shut because of the strike, and appealing to people to go to other facilities.
Which other facilities?
So they were taking care of emergencies, because emergencies have not been withdrawn. But if you could go to other facilities, they would be grateful. But the OPD has been shut.
Yeah. I also know of other, Kumasi, for example.
Komfo Teaching Hospital?
Yes. One of my board members called me and I asked him to go there personally. And he confirmed that yesterday they withdrew the OPD services. a lot of things. Even at the district level, some doctors have taken advantage, even though they haven't received official listen. But the point still valid that once negotiation starts, it will also be just like the simple saying, two wrongs doesn't make right. Once negotiations start, we cannot go on strike.
Is a coalition going to step in? I mean, are you going to make a direct appeal or something?
Yes. Yesterday, we made arrangement to meet the leadership. They are our friends. They invite us to their annual meetings. We also invite
But would
them.
they listen to you?
I'm sure, yes. I'm sure. I'm very, very sure. Because we know them very well.
What are you promising them?
We will appeal to them based on the data we have across the country and the impact.
The impact of the strike
The
action.
impact of the strikers. Even where we haven't been on strike, people still miss out essential health care. So when we have strike, the situation is going to be very, very unpalatable.
But even if you take Korle Bu and you take Komfo-Anokye, these are big hospitals. If you don't get the needed healthcare in any of these smaller hospitals, this is like the ultimate place that you can be. And so if they are not taking care of outpatients, Komfo-Anokye is not, Korle Bu is not, then that's in itself. Just these two facilities is a big deal.
No, but even Tamale, if you take Tamale, for instance, a lot of people travel from the other two regions to Tamale Teaching Hospital for proper, what they term as proper service care there. So if Tamale decide that they are also joining, that means 3 regions in the north are already affected. And that's disastrous. And that's why we want to use, we will gather the information by noon. We would have been sure of the potential implications that will happen. We are also aware of the teaching hospital in Cape Coast. And my vice is from the region, and so this morning he's going there. He should have been here, but he's going there to also find out the situation there. So if we get at least 5 regions and see the potential effect, we will not make a press statement, but we will use internal systems to be able to negotiate behind the scene.
Okay, appeal to the conscience of these doctors.
Yeah.
This is what your action is creating on the ground.
Exactly. That's the appeal we want.
And you're hopeful that will
We
work.
are very hopeful because we are doing research together. Are you getting it? We are in GMA has now become part of the coalition. We are doing a lot of things, technical things together. And I mean, nobody will want to use his left hand to point at his father's house.
Yeah.
And so, for good faith, we think that something can be done.
All right.
But we will not display it for ordinary. We can work behind the scene.
Okay.
You see, good things are done behind the door. So, I think that they have very valid reasons for initiating certain actions. But it is just the appeal that we think that over 25 people will suffer.
Million.
But the minister, we are happy that you have made these moves. We are sure that today's approach will be more enhanced to ensure that the parties' tempers calm down. You see, one thing about negotiation, when you take entrenched position, you raise the tempers. And when tempers are raised, no meaningful discussion can take place. And if discussion cannot take place, the effect is that the ordinary Ghanaians will suffer. And that is what we don't want. So we are expecting to have a professional mediator to play the role to ensure that the parties, they should have a roadmap. And the roadmap should create a very fair platform for the negotiations to be enhanced. But if the meeting is going to happen like the way it happened yesterday, I don't think it's going to be helpful.
All right.
So we are pleading that everybody should put their biases behind them and focus on the issues. Then the interests of the parties will be met.
Okay. We wish you the very best as you go ahead and make this appeal. We pray it works. Thank you so much for your time.
Thank you. And we are willing to give you a feedback of whatever happened.
No problem.
And
We'll start with the impact. We'll start with the impact
exactly,
at midday.
Exactly.
All right.
Thank you
my guest, Gabriel Benarko, is the national chairman of the Coalition of NGOs in Health.